Thank you for joining us for another COVID-19 video update. I'm Brittany Fuentes, a public health nurse at Whatcom County Health Department. Here are some highlights from our weekly COVID-19 update newsflash and data report. More details can be found on our website. The Bellingham Herald is hosting a virtual forum about kids and COVID-19 at noon on Tuesday, October 5th. Whatcom County's health officers, medical experts from Peace Health St. Joseph's Hospital, and representatives from Bellingham Public Schools will be answering questions. More details are available on the Herald's website. Booster doses of the Pfizer vaccine are now available for some people who got their second dose of Pfizer at least 6 months ago. You should get a booster dose of the Pfizer vaccine as soon as possible if you're over 65, living in a long-term care facility, or if you're between 50 and 64 years old and have certain underlying health conditions. You may also get a booster dose of the Pfizer vaccine if you're 18 or older and have certain underlying health conditions, or you live or work in a high-risk setting, such as a hospital, prison, factory, grocery store, or homeless shelter. If you're eligible, you can get a booster shot right away at any place you'd normally get a COVID-19 vaccine, like a pharmacy or pop-up vaccine clinic. You don't need a referral from your healthcare provider to get a booster dose. Right now, only booster doses of Pfizer are recommended, and booster doses aren't available for people who are vaccinated with Moderna or Johnson & Johnson. Do not mix and match vaccine brands. The FDA and CDC are still reviewing data for Moderna and Johnson & Johnson, and if boosters get approved for these vaccines, we'll let you know. You can get more information about booster doses at whatcomcounty.us/COVID vaccine. Okay, let's talk about data. This update covers data through last Saturday, September 25th. Our case rate hasn't changed much from last week. The daily average of positive COVID-19 cases is about 63. Cases in school-aged children are still high and make up about 27% of all cases in Whatcom County. Hospitalization rates are also going down, which is good news for our healthcare system. We're always happy to report declining cases and hospitalizations, but we still need to be cautious. Cases and hospitalizations are still at high levels, and the CDC still classifies Whatcom County as an area of high transmission. Sadly, we have 3 new deaths from COVID-19 to report since our last update. They were an unvaccinated man in his 40s, an unvaccinated woman in her 70s, and a vaccinated woman in her 90s. The best way to protect yourself and our community from the virus is by getting vaccinated. Many of us already have, but there's still about 50,000 eligible people in our county who haven't started vaccination yet. We need as many people vaccinated as possible to keep our numbers of cases, hospitalizations, and deaths from going back up. Last week, 84% of new cases and 82% of new COVID-19 hospitalizations were among unvaccinated residents. If you have more questions about vaccination, testing, data, isolation and quarantine, or anything else related to COVID-19, you can find answers at whatcomcounty.us/COVID. Thanks for watching. We'll see you next time.